Hello everyone, my name is Suzanne El-Chazli. I'm presenting the policy brief advocate about improving preventative measures to reduce incidence of HIV in US. HIV continues to be a major public health crisis in US, with almost 40,000 new cases each year, despite many interventions implemented to reduce incidence of HIV infections. Preventing one new HIV infection can save over $250,000 in costs to the US healthcare system. Despite many laws existing to control HIV high-risk behavior, HIV incidence remains high every year. So this makes us ask the questions: what are the most effective ways in preventing HIV? Why is there 40,000 incidents every year? So the goal of public health to end HIV epidemics is through a combination of sexual health education and routine HIV screening, wide access to both pre-exposure pills, pre-exposure prophylaxis pills and post-exposure prophylaxis on demand, and comprehensive insurance coverage of these interventions to have adequate healthcare access services. Such preventative measures will be the roadmap in ending HIV epidemics. So many federal departments are involved in the domestic HIV/AIDS response, and key US government programs that provide health insurance coverage, care, and support to people with HIV in the US, including Medicaid, Medicare, and the Ryan White program for HIV people. In 2010, Affordable Care Act provided new opportunities for expanding healthcare access, prevention, and treatment services for people with or at risk for HIV. Regarding the state regulations, mainly CDC leads the US surveillance and prevention activities, which are carried out in conjunction with the state and local health departments. Some state and local areas have put forth their own plan to end AIDS, such as in New York State and Washington State. In AIDS program, for example, in Washington State, there is a collaboration between local clinics, testing centers, pre-exposure prophylaxis drug assistance program, local AIDS drug assistance program to reduce the new infection by 50% by 2020. Under the title, Getting Insured, Getting Tested, Getting Pre-Exposure Prophylaxis, and Getting Treatment. So why pre-exposure prophylaxis measures are very important? It's an effective way prevention strategy for reducing HIV acquisition risk by 90 to 99% taken as prescribed. Taken as prescribed, and it's recommended for men who have sex with men, IV drug users, transgender men and women, heterosexual adults who are at high risk for HIV prevention. Pre-exposure prophylaxis is the use of antiretroviral medication to prevent acquisition of HIV infection. It consists of one pill taken once a day, and it's effective and easy to use. At present, the only medication with an FDA-approved indication for pre-exposure prophylaxis is actually oral Truvada. Any licensed prescriber can prescribe pre-exposure prophylaxis pills. Pre-exposure prophylaxis is actually a part of a comprehensive prevention plan that include adherence and prevention counseling, HIV risk behavior counseling, HIV prevention education, and the provision of condoms. However, the limitation for such a huge program, it's actually very expensive. It's not covered by insurance. Without adequate funding, pre-exposure prophylaxis can cost $13,000 per individual per year. And it will only be accessible to those who, unfortunately, to those who has the best private insurance among the other insurances. In order to be as effective as possible in preventive measure, these programs need to be widespread, firmly established, and well marketed. So the policy brief was based on an evaluation criteria that basically to answer the question, couple questions for the recommendation to choose the best recommendation. So what's the perceived consensus regarding the recommendation? Will it achieve the goal in reducing HIV epidemics? Will it end up with the optimal benefits for the greatest number of people? How will law influence the feasibility of the recommendation? Does the intervention benefits outweigh costs? So, in the recommendations that I had are, the first thing is the status quo. The first recommendation is to maintain the existing intervention as the state and the local regulation as it exists today. So the first law, which is the HIV criminalization law, all US jurisdictions have criminal provisions that can be used to punish knowing exposure to or transmission of HIV to another person. However, many studies showed that such laws undermine the public health efforts by providing reasons for persons at risk to not get screened or seek preventative measures, since ignorance of one's health status might be perceived as the best defense in a criminal lawsuit, and worsening HIV-related stigma. Public health, on the other hand, which took over the role in controlling HIV epidemic, has been excelling in achieving the goal of reducing HIV new infection. It's based on two elements: state testing law, which recommend routine HIV testing for all Americans aged 13 to 64, as well as HIV high-risk individuals. The second element is the state laboratory mandatory reporting law. All 50 states and the District of Columbia require healthcare providers to report new cases of HIV to their state health departments. It is, however, this recommendation needs a lot of improvement in healthcare services and healthcare services, which is why I have the second recommendation we go for is the state regulation. Basically, in this recommendation, it's to take an extra stride in an existing public health law screening and testing law by engaging state legislations, healthcare providers, insurance officials, and municipal health departments in the state into aligning resources to increase focus on public health law preventative measures. For example, increasing pre-exposure prophylaxis access to all high-risk individuals in the state, in the local state. Instead of just limiting the HIV prevention measures, pre-exposure prophylaxis to special clinics in high-risk areas, it would be available in local clinics, hospitals, and train healthcare providers to deliver the service when needed, become familiar with the pre-exposure prophylaxis availability, and being more affordable for their patients through their insurance. However, the arguments against such a recommendation, it will still be costly to implement such a huge intervention. It will benefit if such collaboration happen under federal regulation, which is the next recommendation, to allocate the funds to where it's needed. So the federal regulation recommendation is basically expanding the federal regulation activities HIV prevention measures. This recommendation establishes federal decisions about the allocation of resources with regard to the strategies employed, geography, and high-risk population. Also, to ensure the most effective prevention strategies are prioritized and implemented in all 50 states. Activities of the federal government will include evaluating prevention methods, vaccines, antiretroviral medication, long-acting formulation of pre-exposure prophylaxis, and to improve effective delivery of HIV prevention care and treatment. By increasing access to HIV, for example, pre-exposure prophylaxis pills, it would be a part of a package of HIV STI prevention services across all 50 states. This alternative is actually based on evidence that a uniform policy will best benefit the United States as a whole in reducing HIV infection by continuing what New York and Washington states achieved in reducing HIV incidence. This will also replace the HIV-specific criminal law eventually. It will improve public perception on HIV infection, prevent HIV-related stigma, increase awareness about the availability and methods to afford access to HIV prevention services. It will address health inequities, will make pre-exposure prophylaxis easier to access and affordable care coverage to high-risk patients. This intervention will also achieve optimal benefits for every individual without discrimination. Overall, the recommendation, federal regulation will be the most effective way to combat HIV because it increases the access of the states to all of the states to pre-exposure prophylaxis widely as a complete package of STI HIV prevention, which basically includes the condoms, pre-exposure prophylaxis, pills, HIV testing, screening methods, and the treatment when needed. It will support range of services essential in reducing risk of behaviors in acquiring HIV, including substance abuse treatment, injectable drug use. This will tremendously reduce incidence of HIV infections by targeting the root of the high-risk behaviors. Thank you.